of the things that we do in therapy are splinting, as Dr. Garrod mentioned. We use electrical and ultrasound therapies and paraffin and tissue body mechanics, like we just went over today, but on an individual basis, designed for whatever the tasks are that you're required to do. And teach you exercises. Now, these exercises are good to do in terms of prevention. And I'm just going to go over them really quick. And Dr. Garrod and I both have handouts of those exercises.
When you say prevention, you already have it. Are these helpful or not?
They're helpful.
Okay.
If they're done in a graded way. And you have to kind of assess the tolerance for the exercise. But a lot of times, you have to see when you're going to put exercise into a rehab program. You may want to just start with rest and anti-inflammatories and taking away all the irritations, and then you may want to add in the exercise once you decrease the inflammation of the pain. So let's look at these in terms of prevention. If you're working at your computer station, you have your 5 minutes to take a break. You're going to do these exercises, and it's just a series. You extend, you can all try it with me. Extending stretch, both wrists and fingers. And hold them for a count of 5. Then you're going to straighten the wrists and just let them relax and kind of hang. Sorry about that. Then make a tight fist with both hands. And then bend both wrists down and hold for a count of 5, and you can feel a real big stretch on the top there. And then straighten them and relax again. And they advise doing that 5 or 10 times if you have enough time to do it. And when you're done, I went past that one, shaking out your hands to relax them. So in review, we want to reduce the force and relax your grip in whatever activity it is you're doing. Remember that eggshell picture in your mind. Avoid bending your wrists all the way up or down. Take frequent breaks. Improve your posture. And another issue is to keep your hands warm. Sometimes if you're working in a supermarket or a cold environment, that can add to the irritation.
Thank you, Jeannie. So Armand's going to be walking around collecting if you have any questions. If you just wrote them on a little piece of paper. Yes, sir.
Rather than write my question down, I got a question for the doctor. Age is a factor in susceptibility to getting carpal tunnel, number 1. And number 2, if it's possible, percentage-wise, differentiate underlying medical causes versus repetitive motion and ergonomic aspects of carpal tunnel.
Well, first question, age. The average, we don't usually see carpal tunnel syndrome in patients under 20 unless they really have significant mitigating factors, like occasionally see it in a grocery checkout clerk or someone who's involved in a fair amount of repetitive activities. Those are the patients that usually are involved in that type of a work situation. As far as age itself, the only real factor is that unfortunately nerves don't do well as we get older as far as recovery. The regeneration capacity of a nerve as we get older is decreased. So the one factor with age is prognosis. If that nerve is compressed for too long a period of time and the patient's older, that's one of the adverse prognostic factors as far as recovery being guarded. What was the other part of the question? The percentage. Yeah, it's hard to break that out, actually. I mean, you have to really get a good history and physical exam and depend on the patient's medical history and what the information you get from the patient as far as those other non-repetitive type activities and medical factors. So if the patient has